Hi, this is Kendra with the Pooper Scoopers, and I'm here today with Dr. Lisa, and we wanted to go over something that we get asked a lot as pet sitters and I guess as Pooper Scoopers, when you need to call the vet. Like, what constitutes a call to your vet to make sure everything's okay? Because again, like I said in a video we did before, that even though we love Dr. Lisa, and I'm sure you love your vet, you know, bills are bills, so sometimes you don't want to, I myself don't want to wait too long and cause my pet any unneeded discomfort or pain, but I can be a little bit of a worrywart, and honestly, if Lisa hadn't trained me, I'd be calling her every 30 seconds for every sniff, itch, toot, or belch that came out of my animal. So I thought I would just ask Lisa, when do I need to call you? Like, when do you need to hear from me if something's not right?
Sure. It's a really common question, and our pets and our kids, it's easy. We're concerned. We love them very much. We want to do what's best for them always. So let me start by saying that if you think your pet is having an emergency, or you think your pet is ill and needs medical attention, bring your pet in. Call your vet's office. So there's never such a thing as too much attention, I guess, to your pet, and especially, your pet's best.
And she has me as a client, so she understands that I'm not one to second guess myself. I will call as much as I need.
Exactly. If you're worried, just give a call or schedule an exam. It's always better to err on the side of caution. Let's talk a little bit about what's normal for your pet. And know that pets are very adept at hiding pain, illness, especially cats. That's part of being a cat and being an animal, is that they don't want to show that they're weak. They don't want to show that they're ill. Think back to many, many years ago when illness means, being put out from the pack, having to fend for themselves. So they're very good at hiding illness. But as far as normal behaviors go, your pet should always look bright and alert and responsive. They should be coordinated. Their skin should be elastic and snap back when you pinch it. That means that they're well hydrated. A normal temperature for animals, and you can get a flexible thermometer from Walgreens if you want to take a rectal temperature with some Vaseline, please, is 100 to 102.5. So that's a pretty normal range for pets. Heart rate, if you want to put your hand on your pet's chest or even feel for a pulse on the inside of the leg. That can vary depending on the size of the animal, but anywhere from 80 beats per minute to 180 beats per minute for a small pet or a cat would be normal. Respirations, it's great to watch them as they're sleeping, not after they've gone out for a hard jog, but respirations should be about 16 to 26 breaths per minute, so that's a normal thing. Things that you should know about as far as calling your vet. Vomiting is something that can be concerning, especially vomiting that lasts more than a few hours, 12 hours, and your pet can't keep anything down. The pet's at risk for dehydration, electrolyte imbalances, and we need to figure out the cause of the vomiting. Any swellings, lumps or bumps generally are a cause for concern. A pet's losing weight or gaining weight, that would be cause for concern as well. A bloated looking abdomen or non-productive retching would be certainly an emergency. Circling pets that have a tilted head, neurologic abnormalities, that would be something to call your vet about. Pets that are lethargic or that have protracted diarrhea that doesn't have a discernible cause, or that doesn't respond quickly to fasting, no food, for 12 to 24 hours, and then a bland diet for a few days is a good reason to call your vet. Any disorientation, any discharge from any orifice, rear end, ears, mouth, nose.
That goes back to the no smelling. Nothing on your dog should have an odor.
Yeah, should clear a room. So you want to call your vet for any of those reasons. Again, any wounds, abscesses, anything like that, lacerations, it's always good to check in and err on the side of caution.
And we have, besides the Pooper Scoopers, we own Watchdog Pet Sitting, and so I have a staff of pet sitters, and so whenever they think the slightest thing could be wrong, they're instructed to call me directly, and I kind of go over my list of questions. So my general guideline is, because we can't always say the dog's acting normal, because we're not there all the time, mm-hmm. So my general rule of thumb on whether I need to be worried or not is if the dog's eating and sleeping and peeing and pooping. Mm-hmm. Typically, from a, and you know your dog, but from a non-knowing your dog standpoint, if those things are happening, regularly, and as pet sitters we track that. Normally I think I can call the homeowner and say, hey, this is happening, we think we're okay. When a sitter calls me and the dog's not eating or sleeping or peeing and pooping, I know that we need to call the homeowner and then go directly to the vet, because that's something that as pet sitters we're not trained to handle. So the list of things that Lisa went over are great, but if your dog is not acting normal and not peeing and pooping and eating and sleeping, that's something that as a dog mom and a cat mom, I take concern in, and I make sure that I call my vets.
Absolutely.
So if you have any questions, we can't really help with the vet stuff, but we're happy to talk to you. You can call us in the office or find us at thepooperscoopers.com or everythingpet.net. And if you have a vet that you love and trust, that's great. If you don't, Willy Wonka and Freya would be happy to give you a glowing recommendation for Dr. Lisa. And you can reach her at her website, which is The Welcome Wagon. And how's it spelled again?
WAGGIN.
TheWelcomeWagon.com. Thank you.